Thank you for joining us for the next episode of the Growing Together series, where we explore how early childhood professionals and therapists can support children together. This session focuses on speech, language, and social emotional development. We'll share real-life stories, practical strategies, and ways to recognize and respond to challenges with confidence. Whether you're a teacher, caregiver, or support staff, your role matters. So take a breath, settle in, and let's grow together.
Hello everyone, my name is Ann Christopher and I'm an occupational therapist with the Parent-Infant Program in Henrico County.
And I am Gracia Holtz, a speech-language pathologist, also with the Parent-Infant Program of Henrico. I support children's speech and language development through early intervention. In this presentation, we are eager to share more about how we support the development of communication skills. So let's dive into speech, language, and social emotional development and how early awareness and intervention make a difference. So I will start with the basics of speech-language pathology. As a speech therapist, I focus on assessing and treating skills related to communication and social development. Speech-language pathologists, or SLPs, are key players in supporting children's speech, language, and social development right from infancy. We help children find their voices and connect with the world around them. In early childhood, our role is to help babies and toddlers learn to connect, interact, and express themselves, whether that's through sounds, gestures, or early words. We look at the whole picture of communication, not just speech, but how a child understands language, uses it, and connects to others socially. That includes everything from babbling to taking turns in play, following directions, and building relationships. Now here's Ann to talk about the role of an SLP.
In early childhood programs, SLPs assess a child's communication, cognitive, and social emotional development, and also determine eligibility. Once they help develop an appropriate treatment plan for a child, they often work behind the scenes, partnering with teachers and caregivers to make communication happen naturally during play and daily routines. They might model simple strategies during snack time, circle time, or transitions. Providing intervention strategies are the heart of an SLP's work. Through these strategies, SLPs help children overcome challenges, enhancing their ability to communicate and connect with others. Remember, we work with you, not apart from you. You see children in their most natural environment, which gives us valuable insight. When you notice a child who isn't engaging or communicating like others their age, that observation helps us figure out how to support them the best. We also provide ideas and coaching so that you can embed language learning into your classroom routines without needing any extra time in your day. Let's dive into the fascinating journey of early communication in infants. The first year of life is all about connection. Babies are learning that sounds have meaning and that they can get a response from you by cooing, babbling, or smiling. By around 6 months old, you'll start to hear babbling like ba 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 or da da da. Those early sound patterns set the stage for words. These early stages, vocalizations, babbling, and first words, are crucial for language and social development. They set the groundwork for the milestones that follow as children grow, which we'll explore next. By the end of the first year, many babies understand familiar words, like their name or simple directions such as no or come here. They're also beginning to use gestures like reaching, waving, or lifting their arms to be picked up. Even if they don't have words yet, these gestures are communication. They're telling you what they want or need. Social emotional development in the first year is really the foundation for everything that comes after in communication and relationships. We'll start with attachment. This is the bond a baby forms with caregivers, usually parents or primary adults. Secure attachment gives a baby a sense of safety and trust, which is crucial for exploring their world and learning to communicate. Babies also begin to show emotional expression very early. You'll notice smiles, coos, and later fussing or crying to signal needs. These expressions are the first way of communicating feelings and how adults help them to learn and regulate emotions. Lastly, social interactions. Even in the first year, babies engage in back and forth exchanges. Think of cooing games, peekaboo, or responding to gestures. These interactions lay the groundwork for turn-taking, attention, and eventually language skills. Attachment, emotional expression, and social interactions are all interconnected. They shape not only a child's emotional world, but also their emerging communication abilities. Gracia, can you share more about milestones in older toddlers?
Absolutely. Let's start with milestones for children ages 1 to 2. So during this time, we start to see a big communication leap. Children move from babbling to real words, sometimes just 1 or 2 at first, but that vocabulary grows fast. You'll notice more gestures like pointing to show you what they want or waving bye-bye. And even before they are saying a lot, toddlers this age understand much more than they can say. You might tell them, "Go get your shoes," and they know exactly what to do. It's also this is the time that you'll start to hear no about 100 times a day. But that's good. It means they're learning independence and how to express themselves. And you'll notice that they've started imitating a lot. Actions, words, and even your tone. That's why what we say and how we say it matters so much. So we're going to take a closer look at the developmental achievements for ages 2 to 3. By this age, we see what we call the language explosion. Children's vocabulary can jump from a handful of words to hundreds. You'll hear short sentences, lots of questions, and probably a little storytelling, even if it's not always clear. They'll start to use language to share ideas and not just to ask for things. So instead of "more milk," you might hear, "I spilled it," or "Mommy, go work." That's a big shift. They're using words to connect socially, not just get their needs met. And you'll also notice that play becomes more imaginative. They might pretend to feed a doll or drive a toy car. That kind of pretend play shows they're thinking symbolically, connecting language, imagination, and social interaction. So if you're seeing more pretend play, more back and forth, and lots of why questions, that's development that's right on track. And what are the areas that we'll be focusing on today?
We're going to look at 3 key areas of development that we will be exploring together: social and play skills, communication skills, and emotional regulation. These areas are deeply connected. When a child is learning to play and interact with others, they are also practicing communication and learning to manage their emotions. Every child develops at their own pace, but patterns do matter. Your role is to notice, not diagnose. Watch how children communicate, play, and interact. Your observations are the first step in helping families access support. The earlier a potential concern is recognized, the sooner families can get support. Early intervention helps children build strong foundations for language, social skills, and learning. Children who get help early often need fewer supports later. Families also feel more confident and empowered. Observations are advocacy. Share what you see, offer resources, and help families take the next step, without labeling their child. Gracia, can you share about social skills challenges?
Absolutely. So, toddlers may show differences in how they interact with others. Some common signs include limited eye contact, difficulty sharing interests, challenges during turn taking, and these are important to notice because they affect how a child connects with peers and adults. You might also see challenges in understanding emotions or hesitancy to start play with peers. Recognizing these behaviors early helps us support children's social and emotional growth and gives families strategies to encourage engagement. Social communication skills are the building blocks for friendships, language development, and emotional regulation. Early observation means families can access support and children get the guidance they need when it matters most. Even small interactions, a shared toy, a smile, or simple gesture gives valuable insight. So this is a case study about Mark. Let's notice how he's deeply focused on the car. When a child prefers social play, our first step is to observe. What captures their attention? What motivates them? This tells us where to start to engage without pressure. Once we know what a child enjoys, we can gently join their play. So let's start with Mark. We see that he's fully focused on his car and he's playing alone. And as we first notice and observe, we see that it's the car that he's most interested in. So this is our starting point. We don't want to force interaction. We just want to watch him and better understand. And now we can talk about guided play. We have now observed Mark and we know what motivates him. And so we're going to talk about guided play because this is all about how we can join Mark in his world and gently build on his play without taking over. One simple strategy is to comment on what a child is doing. For example, if Mark enjoys pushing his car down a ramp, I might say something like, "That car goes really fast." I could also offer related materials that expand his play slightly. If he's using cars, I might add a train or some blocks nearby, something that connects to his interest but introduces new possibilities. We want to engage and encourage, but never push. Patience is essential because it can take time for children with limited play skills to engage and feel comfortable. Most importantly, we want to celebrate those small steps. Every tiny attempt to share, cooperate, or try something new is a win, and it keeps kids motivated and wanting to try again. So, Anne, what other strategies can be done to help build those everyday interactions, especially with peers?
Great question. Social skills are built through everyday interactions, and play is one of the most natural ways to promote them in the classroom. Let's talk some strategies. First, encourage group play. Small group games, circle time, or cooperative pretend play give children opportunities to interact, negotiate roles, and practice communication. Next, collaborative projects are another great tool. Activities like building a block tower together, creating a classroom mural, or exploring a sensory bin as a group require children to work toward a shared goal and communicate along the way. Finally, sharing activities help children learn turn-taking and patience. You can do simple turn-taking games, pass items in a relay, or take turns playing instruments or puppets. Celebrating each child's contribution reinforces positive social interactions. One of the most effective ways teachers can support social skill development is by modeling positive social behaviors themselves. Children learn a lot by observing how adults interact. And let's be honest, Loud, busy classrooms full of toddlers can be overwhelming, but young children are still learning how to regulate, and they take their cues from us. First, let's provide encouragement. Acknowledge children's efforts to share, take turns, or cooperate. Simple praise like, "I love how you waited your turn," reinforce this behavior. Next, demonstrate appropriate social interactions. Show children how to greet peers, ask for help, or offer a toy. Acting it out gives children a clear example of expected behaviors. Finally, provide constructive feedback. If a child struggles with a social interaction, guide them gently. For example, you can wait your turn by handing the block to your friend first. Feedback helps children understand social expectations and improves future interactions. Gracia, as the SLP, can you talk to us about communication difficulties?
Absolutely. So here are some signs that a toddler might be struggling with language development. We want to recognize these signs early so that we can support behaviors before delays become more challenging. One common sign would be the limited use of vocabulary or spoken words. A child might have difficulty following directions, and even simple directions might need to be repeated multiple times before a child will act out on them. We might see a child not responding to their name or avoiding interactions with others. Finally, frustration with communication challenges is common. When children can't get their needs met, it often leads to tantrums or distress. So when children can't communicate effectively, they may express themselves in ways that appear inappropriate, such as grabbing what they want or hitting others to express frustration. Please know that these are signals. That child is not trying to give you a hard time. They are having a hard time. Let's look at Sarah. She shows some language difficulties and a lot of frustration when she can't express her wants and needs. So the first thing that we want to do is to observe what Sarah likes to do and what activities she naturally gravitates towards. This gives us insight into how we can create opportunities for her to use her language. Next, we're going to notice that when she attempts to communicate, even if it's just through gestures, single words, or sounds. These are her first attempts at language, and recognizing them is key. It's also important to track what encourages her to respond or participate. Is she more likely to talk when playing with a peer or during a favorite activity? These will be the motivators to guide our support strategies. Once we know what engages her, we can model language by labeling objects, describing actions, or expanding on her words. For example, if Sarah says car, we might respond with yes, a red car. The car is driving fast. This shows her how words connect and grow. By observing, noticing attempts, and using her interests as a bridge, we can create meaningful moments that support Sarah's communication in the classroom every day. So we hope that we can eliminate those difficulties of grunting or whining, grabbing what she wants, becoming easily frustrated, which might result in hitting sometimes, not following classroom directions, and Sarah's avoidance of peer interactions. Once we have observed a child and identified their motivators, we're then going to use strategies to actively support language development in the classroom. Anne, can you give us some strategies?
Sure. Start by joining the child's play and following their lead. Comment on what they do or say and expand their words to model richer language. Repetition is key. Repeating new words or phrases throughout the day helps the child to internalize them. Music, songs, and rhymes are excellent tools. They make language fun, support memory, and encourage children to participate. Ask open-ended questions to get the child talking and thinking. Provide materials that spark conversation and encourage interactions with peers. And as always, celebrate small attempts. Each time a child uses a new word, responds, or interacts, it's a step forward in their language growth. Now let's look at some specific activities that promote communication in the classroom. These are simple to implement and can make a big difference for toddlers like Sarah and Mark. First, read books. Reading picture books, board books, or interactive books gives children exposure to new words, sentence structures, and story sequences. Asking questions about the pictures or story encourages them to respond. Next, music and movement. Singing songs, doing rhymes, or using instruments and movement games helps children learn words through repetition and rhythm. It also keeps them engaged and makes learning playful. Finally, use language-rich toys like pretend play sets, puppets, and blocks. Encourage children to use words, practice social language, and explore ideas in a fun, hands-on way. Let's talk about visual supports. We spoke a lot about these in episode 2, so refer to that for more details. Using visual supports can help with communication and can be very effective. Visual schedules help children understand routines. Baby signs and gestures support comprehension and reduce frustration. Gracia, how about discussing social emotional challenges?
Sure. Toddlers are just beginning to learn how to manage their emotions and behaviors, and some children may show challenges in emotional and self-regulation. Frequent tantrums and difficulty calming down are common signs. Some toddlers may have intense emotional reactions that are hard to soothe, even with adult support. Impulsive behaviors like grabbing toys or acting without thinking can also indicate self-regulation difficulties. These children often struggle to pause and consider their actions. Transitions can be particularly challenging. Moving from one activity to another or adjusting changes in routine can trigger frustration or resistance. Some children overreact to minor changes, while others may have limited ability to share or take turns with peers. Both are signs that self-regulation skills are still developing. Strong emotional responses to sensory input, like loud sounds or crowded spaces, are another indicator. Recognizing these behaviors helps us support toddlers in learning strategies to manage their emotions and build self-control in the classroom. So let's focus on supporting a child who struggles with emotional regulation. This is Jeremy. Jeremy is 2 years old and often has strong emotional reactions. He cries and knocks his toys off the table when he gets frustrated. So let's start by observing him closely. What triggers his reactions? So we notice that Jeremy struggles most during cleanup time and when the classroom gets noisy. He also seems to calm faster when he's given a quiet space and visual cues. So we share these observations with his EI therapist, and we started to use a picture schedule to show what's coming next and offer him a sensory bin to help him regulate. Jeremy didn't change overnight, but with consistent support, he started to transition more smoothly and express his feelings with fewer outbursts.
Let's look at how we teach emotional regulation, especially for children like Jeremy. We start by labeling emotions. You look frustrated, or that was surprising. Then we model coping strategies, taking deep breaths, squeezing a fidget toy, or asking for help. We should practice these strategies during calm moments, not just when a child is upset. We can also use consistent routines and visual supports to reduce anxiety. And also, we should celebrate small successes, like when Jeremy puts his toys away without tears, or he uses a gesture to ask for quiet. These skills take time, but with practice, patience, and teamwork, children learn to manage big feelings in healthy ways.
So And I'm going to go ahead and talk about how we can be a behavior detective. In fact, that is the best way to think about our roles here. So let's take a moment to reflect. Let's think about a child in your classroom who's having a tough time. Maybe they cry during transitions, avoid group play, or seem frustrated often. Instead of labeling the behavior, let's be curious. Be a behavior detective. Let's ask yourself, what's happening? Where does it happen? When does it tend to occur? And why might this be hard for the child? These questions help us move from reacting to understanding. And once we understand, we can try strategies that support, not punish. Remember, you're not alone. If you're seeing consistent patterns that impact learning or relationships, talk with your team. Share your observations with an early intervention therapist. We're here to help. So we know that you might still have questions. So let's go over a few that we hear a lot. What if a child doesn't talk but understands everything? The answer would be, that's a great sign. Keep modeling language and consider a referral if progress is slow. Another question would be, how do I know if a child is just shy? Shyness is normal, but if a child rarely interacts or avoids communication altogether, then it's definitely worth watching. Another question would be, what should I say to parents if I'm concerned? Let's start with strengths. Share specific observations and say something like, I've noticed she's not using many words yet. Let's talk about how we can support her. And do you have any quick tips for people to remember from this presentation?
Sure. Let's start with following the children's lead, using short, clear phrases, celebrating small steps, watch for patterns, not just one-time behaviors, and also partner with families and therapists early. You don't have to do it all alone, and when we grow together, teachers, therapists, and families, and the children thrive.
Okay, so we want to make sure that we are addressing the parents' concerns effectively. And I know that that is something that we get a lot of questions about. So we'd like to talk about how to do that. It's important to choose the right time and setting. Again, start with the child's strengths and share specific observations. Try not to label the child and keep your tone supportive. You're partnering, you're not diagnosing. Introduce early intervention as a resource and offer next steps to a joint conversation with an SLP or your program lead. Framing it as partnership invites trust and action. And how can early intervention help?
Your role as the teacher is to notice, support, and connect families to the right resources at the right time. Referrals don't always guarantee therapy, but they can provide clarity. So you'll see here on this slide is the phone number for the Henrico County referral line if you have a child that needs some help from us.
And Ann, do they need a doctor's note or a script from the doctor?
No referral from the doctor is needed. The parent can just call the referral line and get their child scheduled for an assessment.
What if a child is over the age of 3?
Then they would go to the school system or outpatient clinics if they need some help.
So our referrals are for children, infants to 3 years old?
Yes, up to age 3.
Thank you, Ann. Okay, so Ann and I would like to give you a big thank you.
Thank you for spending time with us today. We hope this episode gave you new ways to observe, connect, and support the children in your care.
Remember that every small moment matters. When we model connection, celebrate progress, and partner with families, we help children thrive.
We're so grateful for the work you do, and we're here to grow with you, one episode at a time.